We collect good data in Canada on people's health, but it's not always combined in a way that's intelligible or easy for people to access.
I was the spelling bee champion in grade 8, and now I work in marketing communications. So we're both award winners. That's really cool.
We have a big May 11th seminar coming up. The theme is digital modernization of public health, including a presentation from Lauren Gardner of Johns Hopkins and the dashboard that she created to monitor COVID around the world.
Why should people care about GIS and public health? Like what's the big deal? Hi, thanks for joining us. Next up in this Get to Know Public Health at Esri Canada series is Kieran Petrasek. So similar to our last video with Brian Mosley, I'll be asking Kieran a couple of questions so we can all get to know him better and learn a little bit more about public health here at Esri Canada. Kieran, are you ready?
I'm ready. Thanks, Vanessa.
Okay, awesome. Okay, so first question, an easy one. Tell us about your role at Esri Canada.
Sure. So my role at Esri Canada is the health geography lead. And what that means is that I'm responsible essentially for all of the public health and other health data that we maintain. It's important for us to maintain a robust set of data that our clients can access at Esri Canada so that we can better connect them with the vast array of public health data that's out there, especially the spatial data that's out there, demographics, health metrics, even diverse things like environmental metrics that affect people's health, COVID statistics, and things like that.
Second question, and I find this question very interesting because I think there are a lot of different paths that people take to get to Esri or just to develop a fascination with GIS in general. So can you tell us a bit about your GIS journey?
Sure. I feel like I'm somebody who's always loved maps. I've always loved navigating and geography from a very young age. And actually in high school, we had awards for each subject, and I won the geography award as I graduated. So it was my calling from a young age, probably. And really, I think I'm drawn to the interdisciplinary nature of GIS. The ability to combine so many different disciplines. Everything has a place, everything has a location, and you can really combine a lot of different subjects when you use that unifying theme of location. And GIS is really analyzing places and figuring out what's similar about them, what's different about them, and displaying that in interesting and useful ways.
I was the spelling bee champion in grade 8, and now I work in marketing communications. So we're both award winners. That's really cool.
That's right. Yes.
Okay, so next question. And there might be someone watching this video right now who's thinking this maybe can help them understand. And that's, why should people care about GIS and public health? Like what's the big deal?
Yeah, it's a good question. I think our geography and our environment affects every aspect of our health. There's no separating where you are from your health. And there are myriad different ways that shows up. So that could be access to healthcare. People who live in certain locations have different access to healthcare. Ideally, we would want it not to matter where you live, and you should have the same access. You have the same quality of care that you can get to, the same specialists that you can see. But unfortunately, we're not there yet in Canada, and so we need to figure out where those access gaps exist spatially, and figure out ways to address that. That's a big one off the bat.
Okay, so next question. And this is a fun one, just to help us round out this conversation where we get to know you. Can you tell me about your hobbies outside of work?
I love camping. I love, experiencing everything that Canada has to offer when it comes to the great outdoors, canoeing, going up north in Ontario. I got a chance in the past couple of years to go to the Rocky Mountains for the first time and to go to British Columbia. And and I love being outdoors, and I'm happy that the weather is warming up now because I'm excited to get back out there, and I'm sure we all are. I like biking. I like biking around the city. I'm maybe one of the braver ones in Toronto who has been doing it my whole life, you know, kind of without fear, for better or for worse, biking through this hectic city. But that's something I love to do. I love to explore new places on my bike, and just to uh, again, when the weather's nice, get out there and get active on my bike.
Such a well-rounded individual you are.
Uh, well, that's geography. It's a
Yeah.
well-rounded subject.
Last question, and one I'm sure we're all interested in hearing about. What can we expect next from you and your team?
We have a big May 11th seminar coming up. The theme is digital modernization of public health. So we'll be displaying a bunch of solutions on how GIS has helped public health practitioners to modernize their workflows, including a presentation from Lauren Gardner of Johns Hopkins and the dashboard that she created to monitor COVID around the world. As well as presentations from a number of our partners across Canada who are doing really cool and interesting things with GIS and public health. So definitely attend that if you get a chance. It's coming up on May 11th. We are undertaking a large expansion of our public health open data at Esri. So that includes curating a bunch of new open data that we don't currently have in our Living Atlas and making it available across the Esri suite of products to our clients. That's more demographic data, that's more specialized health regional data, flu information, public health information from municipalities, from the provinces, environmental metrics that are important for people's health, wastewater monitoring of COVID-19. There's a huge list of stuff that we're curating and working on putting directly in front of our clients so that they have it at their fingertips when it comes to spatial data that's useful for public health. And then also just building better metrics to measure general public health in Canada. We have actually a lot of data. We collect good data in Canada on people's health, but it's not always combined in a way that's intelligible or easy for people to access or to evaluate whether or not public health interventions are working, or if people's health is getting better or worse in certain regions. So a lot of interesting new metrics that we're developing on that side that we hope to present soon.
Yeah. Okay. Well, thanks so much for chatting with me today, Kieran.
Thanks, Vanessa. It's been great to talk.
Awesome. And thank you for tuning in to watch this video. To learn more about public health at Esri Canada, you can check out our website. And if you want to know what we're up to on a day-to-day basis, you can follow us on Facebook, LinkedIn, Twitter, and Instagram.